task force and has provided lots of information to us along the way and in the background. And Jenn, go ahead and tell us a little bit more about yourself and then launch into your information today.
Sure. Thanks for having me today. So my name is Jenn Klus. I'm with the Colorado Department of Public Health and Environment. And I do post-diagnosis cancer work and palliative care. So I was going to share with you some of the new tools that are out. Can I share my screen, Janice?
Yes. So I will stop sharing and you can have at it.
Perfect. Okay, you guys can see it?
Yep. Mm-hmm.
Okay. So the first tool I wanted to start with is the Palliative Care in Colorado report. So this is the third iteration of this report. This latest version was just released last month. And to give you all some history, it started back in 2008 when the Colorado Health Foundation and the Rose Community Foundation, they funded this state hospice and palliative care organization to complete like the first statewide survey of palliative care in Colorado. Then in 2013, CIVIC, or the Center to Improve Value in Healthcare, they contracted with Hospice Analytics to replicate and expand that first survey. And then moving towards 2019, the CDPHE, in partnership with HCPA for Colorado Medicaid, and the American Cancer Society Cancer Action Network, and CIVIC again, we contracted with Hospice Analytics to do the third statewide survey. So Court Kessner was the principal investigator for all three surveys. And what happened is we contacted all 95 hospitals in Colorado, all 76 hospices, and then known community palliative care providers. We reached out to them in 2019 and then early 2020, and they participated in a brief phone survey. So if you want to see those survey questions, they're in the appendix of the report. But to start, we use the Colorado definition to help define if a program was delivering palliative care. If I may, I kind of want to just go into what palliative care is. I think you all may already know, but because there are so many misunderstandings, and it also will help clarify kind of what came up when we were trying to define whether or not organizations were delivering palliative care. So a lot of these pieces are in our state definition. Palliative care is a medical specialty that provides an extra layer of support for people suffering from serious illness. Suffering can come in many forms. It can be physical, like pain and nausea and vomiting. It can be emotional or social, such as anxiety, depression, spiritual, existential distress. Suffering can come from difficult communications, that being like patients are having difficulty communicating with those that matter, or maybe even their providers, or even navigating like all the specialists or care not being coordinated. So palliative care is delivered alongside treatment. So many patients that are receiving palliative care are receiving curative treatment. It's a team-based approach, meaning that there's usually a physician, advanced practice, professional nurse, social worker, and chaplain. Those are kind of the core team members. They work with that primary provider, so they would work with the oncology team or the cardiologist. It's appropriate at any age, so neonates, pediatrics through adults, and at any stage. But really, palliative care is most effective early in the course of a serious illness. And what we did see in this report is most of the referrals in Colorado are coming in very late stage. So we're hopeful that over time that changes and we are able to see more early stage referrals, because palliative care can improve quality of life for both the patient and those that matter for them. And there's research that shows it may even extend life. People can live longer, and really not all palliative care leads to end of life. Some people will have it for a while and then they'll go back on, back to normal life. But as I mentioned, we use this definition to define whether or not an organization was delivering palliative care. So organizations that were maybe missing an element of the definition, or they didn't have any consults in 2018, but were starting services in 2019 or or planning on starting services, we kind of clarified them as emerging providers. What we did find though is there were some organizations that had very slim team makeups, meaning they had a advanced practice nurse or maybe just a nurse that went out, but they really didn't have that team approach. So in some instances, we classified them as emerging providers as well. And some quick statistics on serious illness. This might be a year or two old, but it's still pretty recent. We have 90 million Americans living with serious illness. And the number of people living with at least one chronic illness is planned to increase to 157 million. So today, 7 out of 10 Americans will die from chronic disease. Yet fewer than 5% of individuals who could benefit from palliative care actually receive it. So I think that just shows we really have our work cut out for us. So here's just an overview of kind of what we saw in the data. So just as an FYI, the data is only as good as the person we interviewed. So we tried to find the best contact at each organization, but we had to rely on the data that that particular person gave us as correct. One thing we hope from this report is that we can show that there's really a need to have more of a consistent statewide data collection, because what happened is the data has not been consistent year over year, study over study. So in 2007, the survey asked organizations about the number of palliative care patients they served. And then moving to 2012, the survey asked about the number of palliative care consults. And then in 2018, we tried to ask both consults and patients. But what we found is most organizations were not collecting both. They were collecting one or the other. So in order to show kind of consistent study over study data, we had to calculate an average, and we came out to 3.9 consults per patient. And that came out pretty close to CAPC, the Center to Advance Palliative Care. They did a national kind of average and they came up to 3.2. But just taking a look at the chart, you can see hospitals. We saw some growth in providers, but not a significant number of growth, but we really did see that growth in patients and consults. And then when you pop down to hospices, that's really where we saw the chunk of the growth. The providers, we went from 11 to 19 to 29. And then again, a big growth in patients and consults. And then you can just see when you go to that total, we really are seeing like that year over year or the study over study growth. Definitely in patients and consults, but not as dramatically in the number of people providing care. This was also the first time we found another provider. And what that means is this is an organization that is not a hospital and not a hospice. It was actually an outpatient clinic that was delivering services. And this is also the first time we asked about pediatric palliative care provision. So the data here shows that there's really a shortage of available pediatric palliative care, and this is due to both appropriately trained providers and low reimbursement rates, which is really the same issues we see with the adult population as well. But what we found is in 2018, there were 2 pediatric specialty hospitals delivering palliative care, and then there were 7 hospice organizations that provided pediatric palliative care, and they served anywhere between 1 to 40 patients. So kind of what I've learned is there's some organizations that are trying to have a peds wing and see more of those patients, and then others that will take them, but maybe don't have as much experience or don't see as many patients. Here you're going to see, we kind of took the data from the report and we put it into a map. So we wanted to illustrate where does palliative care services, where are they available across the state? And you can see, which is probably no surprise, the majority is in the metro, kind of that I-25 corridor, and very limited services in other parts of the state. Being able to map this out visually helps us identify the gaps within our state. And then just looking, if you look at that northeast corner, there's really no services currently available in that area. Here, this slide shows me more detail on the IDT or the interdisciplinary team makeup. So you'll see in hospitals, they're typically about a 5 FTE, and hospices were slightly lower at 4.5. The team makeup is fairly close. You'll see physicians, advanced practice and nurses, social workers and chaplains. Though in the hospice side, they were definitely more dependent on nurses and they used physicians less, and that kind of team diversity was a little bit less. I'll talk about that here when we get into finances. Reimbursement for palliative care has been a long-standing issue. So about half the hospitals reported adequate financial resources, but they all cited the challenges of lack of staff. And then in hospices, it's kind of the same thing, like half were able to bill for their services. And what that means is there's no palliative care benefit, like there is the hospice benefit. So really only provider time can be billed. So that's physician, advanced practice professionals can bill. But that means team members that are so crucial, like the social workers and chaplains, they cannot bill for their time. So then these programs have to find a way to pay these important members of the team. Some programs really haven't been able to use the full team because of these financial limitations. And this is really one of the things we saw when we surveyed these different organizations, is some of them, they didn't use that team approach, kind of like I mentioned earlier, or they had to borrow staff. And this happened both in the hospital and the hospice, as maybe they would borrow a social worker from a different area or a chaplain, or borrow the hospice social worker, but that every patient wouldn't get that service. And then I want to show you all some trends we saw over the years. So the first is with hospice and palliative care certification. And this is really specific to physicians and nurses. If you look from 2012 to 2018, the number of providers certified has dropped from 85 to 75% in the hospital, and then 74% to 50% in the hospice. But then we saw an increase in 24/7 access, where we saw a smaller increase in the hospital from 2 to 5 programs, but then we saw quite a big increase in hospices from 5 to 15 programs. So that's just, just some interesting changes we're seeing over the years. Virtually all palliative care teams reported providing the following services. So pain and symptom management, patient and family meetings that included clarification of the goals of care, advanced care planning discussions. Often, if the patient didn't have documents, then the completion of documents. Nearly all palliative care teams also reported using the medical durable power of attorney in the most form. And then here you're going to see the top diagnoses we found. Of course, this is not an all-encompassing list. This is just the most common for Colorado. Anyone suffering from serious illness may be appropriate for palliative care, but cancer kind of popped up as the top diagnosis we see in Colorado. And this is not the case for other states. Many times we'll see cardiac before cancer, but that's what it looked like in Colorado. Just to note, some states that are or have developed Medicaid, like a Medicaid benefit for palliative care, they will limit diagnoses just as a way to start that benefit. But typically, again, any diagnosis that's a serious illness and there's suffering involved is appropriate. And then I wanted to highlight an interesting model we found in Southwest Colorado. The Tri-County Health Network, they had a non-traditional program to meet the needs of their community. So this program did not fit into the definition of palliative care, but they were able to develop a community-based model of services, again, that fit the residents of their community. This program provided no clinical or medical services, but it was more of like a wraparound support. And they had 2 programs within their palliative support services. And this was really a creative solution to meet the needs of their community. And we hope that it can maybe inspire other unique community-based models, both in rural and urban, to help with that shortage of palliative care that we do see across the state. You can find more in this program, again, in the appendix of the report if you're interested in kind of reading more. Oops. And then jumping into challenges, what we found is like the first 2 are really focused about that funding and reimbursement, as I pointed out. The programs reported having that support, but they just had those widespread financial challenges. And again, that need to add staff. And then again, that making it difficult to have that team-based approach and to fund those additional staff members because of the reimbursement challenges. The other challenge noted by all palliative care programs was the lack of education. So awareness on what palliative care is and when it's appropriate is just another long-standing issue the field struggled with. But it's not just awareness for the general public. It can also be for some referring providers like those primary cares, specialists, hospitalists. And so we kind of expected that back in 2007 that there would be like that confusion or lack of understanding, but we're still seeing the same thing future forward in 2018. And then the last challenge was really, again, we're just seeing those late stage referrals, and there's a lot of work that needs to be done on upstream provision. The recommendations that came out of this report: additional funding for palliative care. Because there is no Medicare nor Medicaid benefit in Colorado, we really have to find a more sustainable reimbursement. We need to develop that consistent data collection and reporting tools, because as you saw, we have some people collecting patients, some people collecting consults, but we just don't have that consistency. Statewide education, networking, mentoring, practice standards, advanced care planning has always been another big area that we need to work on as a state. And then we need to explore and strengthen rural and pediatric palliative care. Overall conclusions that came out of this report is that palliative care continues to grow in Colorado. The number of people receiving palliative service is increasing and quite rapidly. So this is really a positive step towards better health, lower cost, and just a higher quality of care. But while that number is growing, the number of programs is not keeping pace. So the same providers are delivering palliative care that were in 2008, but it's reaffirming because we're seeing these providers and facilities seeing that palliative care is a really valuable service to patient and then their family members. And then looking at the map of palliative care, access, right? There's an uneven distribution of access to services. And then as a state, we really need to work towards those early referrals to support and help those suffering with serious illness. So the second tool I wanted to show you today is this map. One of the needs identified in the report is that we don't have a statewide directory of palliative providers. So there's no place you can go and look and see who in your county or in your area delivers this service. So Civic and Kari on this call partnered with CDPHE, and we developed this new mapping project. This too was just released, so it's still a work in progress. But what it does is it shows all the palliative care providers across the state. It will give the user an address, a phone number. There's even a contact and an email at each organization. If you click on the organization, you can see the team makeup, so you know what kind of team members are on that team. There are filters where you can filter by county. You can filter if they have 24/7 access. Do they treat pediatrics? And then settings such as, hospital, hospice, whatnot. As I mentioned, this is the first release, so it needs a little bit of updating. There's still some organizations popping up here that are not delivering palliative care, but those organizations show the team makeup as 0. So we're in the works of updating this. But ideally, this is a place for patients, caregivers, and providers to go to find provide service providers in their area. Here's the link to get to that map. The intent of this project is for the state. It's whether it's patients, providers, we want you all to know where these services exist and to get that quick view of what the programs offer. So I ask, share this with your colleagues, share this with your patients if it's appropriate, and then share feedback with us. We want to create the best tool, so you can share that with me, you can share it with Kari, but we want to make something that is great for the state. So now moving on to the third tool, the palliative care roadmap. So the picture you're seeing here on the screen is a roadmap developed by Washington State. And it's about a 30-40 page booklet, and it's a guide for patients and those who matter living with serious illness. We saw this and thought, gosh, this is really something that Colorado needs. So we reached out to Washington and they granted us full access to use their content. So what we're doing is we're creating a Colorado version of this roadmap. To give you an idea of how it's been used, at least in Washington. So initially it was created for patients and families as the primary target, But many clinicians found it equally valuable in helping referring providers and even executive leaders can better understand palliative care across the continuum, especially those that were not familiar with palliative care being provided concurrently with disease-specific treatments. Washington has also worked on getting it into the hands of primary care and other subspecialty teams. So rather than waiting until patients are being referred to palliative care and hospice, can I get it in there beforehand? And then community palliative care programs have found this roadmap really helpful. So when they get a referral, a patient referral, and the patient says, well, gosh, I'm not sure why I'm here. What is palliative care? They can kind of pull out this booklet and go over sections of this book with that patient and those that matter to them. So again, we're going to tailor this to Colorado. That will be kind of like an advanced care planning section, putting Colorado resources, and we're adding a few sections. But here you have an example of like what some of the internal content in this roadmap. And this just starts with healthy at any age, and it kind of moves through illness, questions that patients may have or may think. There are multiple sections in this roadmap. Some like starting sections are, what is palliative care? What are healthcare conversations? In there's like how to make the most of your appointments with tips such as like having your questions ready or bringing someone to help you ask those questions or to take notes. Again, there's a section on advanced care planning and what happens if you haven't designated a medical durable power of attorney in the state of Colorado. And then a section on how to support a loved one with serious illness. Here's another example of a slide. Again, you'll see like it has the questions, what you may be wondering, what to expect, what you can do. We're also planning on adding some sections on diversity, something specific to the Hispanic Latino community. We hope to be able to translate this roadmap into Spanish, have something for LGBTQ, Black African American. We're just working with external partners, trying to make sure this has content that's appropriate for all residents of the state. And we will also be adding a pediatric section. That was something that the Washington roadmap did not have. And then since this is a survivorship group, I wanted to show you all a piece of the survivorship section. Again, you kind of have those questions, what to expect. Most of these sections, like these little pieces of the illness trajectory, are 2 pages long. So they're just little bits of content, so it's easier to digest without overwhelming the reader with too many words on the page. Some of the last sections of the book, when illness or health conditions worsen, loss and grief, end of life, which is inclusive of death and dying, and then we'll have like local resources. Now, Washington on the sides of every page put quotes. I think that's something we'll follow suit with, but we're always looking for new quotes or quotes that you all might think would be helpful. So with this project, we don't have any specific grant funding, but we just really felt it was something important for Coloradans. I think one of the biggest issues is going to be printing. Our plan as of right now is we will have a kind of home printable PDF, so a patient and family could print it from home, and then we'll have the nicer copy that organizations can print. So we are pulling in organizations from across the state to partner and to contribute. So we're hoping that we can really get that buy-in that this is an important piece to have in these clinics and that make sure everyone has access to. You know, we do understand that not all organizations will have the money to print, so we will have some printed copies. I just don't know that we're going to have like enough to spread across the state. So this is a work in progress. I don't know when we'll have a final version, but I wanted to make sure you all kind of saw what was in the making. And then last but not least, if you recall, when I was talking at the beginning about the results from the report, one of the challenges that was noted was lack of awareness or education on the role of palliative care, both within the general public and for providers. So I've been working on a video series. It's not ready either, but it's much closer. And what it is we're going to have 4 videos. We interviewed a palliative team member from every large hospital system and then some community organizations. So we made sure it was We had physicians, we had nurses, advanced practice nurses, social workers, and chaplains. We unfortunately only got one patient. We did film during COVID. I think we started in October and wrapped up in January, February. So we got one patient. These are going to be short videos, maybe about 3.5 minutes. So there'll be a general video, like what is palliative care, how palliative care respects you as an individual. So that's really like how palliative care will address you as a person and put you at the center of care. We're creating a provider video that will really help providers understand, why should I refer to palliative care? When's the best time? How can palliative care support and offer quality of life to their patients? And then how palliative care really works with them or with providers. There will be an advanced care planning video. And then we've got so much video footage. We will have social media clips, short clips on different topics. Again, the intent of this project was, so it's statewide. So we want to share it. We want everyone to use it. If any of this is helpful and you guys want to put it on your websites or your social media, that's really the intent of creating this. So please let me know that. And I hope, especially during COVID, that we can show the value that palliative care brings to the residents of our state. And I was going to try to show you a video clip, but it looks like it doesn't work. So I'll make sure you guys can see those when they're ready. And at that, thank you. There's my contact. Here's a new and better website. So there's different sections on palliative care. The Palliative Care Report sits on this website. There's a link to the map as well. And then the videos will also be on here if you want to take a look at them. And that's it. Thank you all.
That's awesome. That's a lot to take in and think about, Jen. It's very thorough. I imagine other folks have some questions, and I'll just start out really briefly in terms of the website or map that shows where the programs are located. Is that something that you will maintain in terms of updates, or will those agencies have access to update their own information?
Those updates will come to either myself or Kari, and then Civic will do the updates on a quarterly basis.
Okay, great. Good to know. And that's very helpful. That'll be especially helpful for people who are referring to those agencies and cancer programs and hospitals. So thank you. What other questions do you have for Jen about this report and the wonderful developments along the way?
Jen, this is Carlin. I just wanted to say thank you for all that you have done. Kari, thank you for all that you have done. We absolutely will share your recorded presentation. We will absolutely share your slides and your content with our large task force email group. We certainly want to support you and put the content on our website as you see fit. So however we can stand behind you to do the right thing, we will do it.
Thank you.
I have a quick question.
Mm-hmm.
I'm wondering about, I know that that pain is a big issue that people deal with in end of life, and I'm wondering if you have a section on that, and if you do, I'm assuming you probably do, but if you have a section on other ways to manage pain in addition to drugs. I mean, there are lots of meditation, yoga, energy therapies, nature. I mean, there are lots of ways. I'm just wondering if you have anything in there about that.
We do have a section on pain. It's pretty limited, but that we're open to expanding that. So I think that's a great idea. If that's something you want to help us write, or who might be able to help, I would ask you for that, just to make sure we have the right content.
I can certainly write from my area of expertise. I'm not an expert in all of those areas, but we have other people on this call that might be,
And I think, there may be opportunities for people to contribute parts of it, maybe not the whole thing. So I
Yeah.
welcome you all to do that as well if there's a segment that you feel like you can take on. And then Jen, do you or have you worked with the National Hospice and Palliative Care Organization with regard to both the content as well as the location of registered providers?
We've reached out and tried to look at national organizations and found most of them don't have a comprehensive list. So, but we have shared, like we've shared the report with the National Hospice and Palliative Care Organization, and we are sharing the work that we're doing nationally. And we've definitely got a lot of interest from other states looking to replicate some of this work in their state.
Wonderful, very good. Any other questions for Jen about this report?
I just want to say thank you, Jen. This is amazing to see, especially being new, newish to the state for a year, and where things are and where the gaps are, and maybe where research can go to support families. Like I love seeing about the Tri-County program and how they've been innovative and reaching out. And I'm going to reach out to them and see if they need any help with anything. That's neat to see.
Thank you.
Very true.
There's fast facts from the Medical College of Wisconsin, which depending on copyright, they literally put out a new topic every single week, and they really have established themselves as subject matter experts. So maybe creating an internet resource site, and I can talk with you offline, or we can solicit from the task force other resources.
All right. Any other comments or questions for Jen? All right. Well, as Carlin said, this recording and the resource links will be on our website a little later on. And so watch for those if you wanted to review the material again. And also certainly contact Jen in terms of her email address. Jen, do you want to go ahead and put your address in the chat again in case people didn't pick it up from the slide?
Absolutely. Yeah. If you all have any, you look at these tools, you have any comments, suggestions, please send those my way.
All right. Sounds good. Thank you. All right. Are you able to see the agenda on my screen again, everyone? Oh, but it looks like it's reloading. Not quite sure why. The internet is, I think, giving us all a little bit of a fit these days with unstable and weird things happening. So, all right, well, let's move right along in terms of the time that we have available. I have 3:38, so we'll do our best to honor your time and attention here today as well. So as far as our task force updates, generally, we are continuing to work on our action plan, and one of them is to continue providing information and education to all of you that's relevant, both by separate webinars as well